In this video, we're going to look at the top 5 most common care assistant interview questions, and we're going to learn how to plan fantastic answers that will land you the job. So the first question that is basically guaranteed to come up in these sort of interviews is, what hours can you work? And this is very important to give a good answer to, and it can make or break the interview. So the first thing you have to show is that you're a very reliable person, and that if you say you're going to make a time, that is something you're going to stick to. You want to show as much flexibility as you can, because shift times can be changing based on staffing, and you want to be adaptable to that. And you have to show that you're very open-minded and you're not completely going to shut down certain times. So some great things to mention, and what care assistant employers really want to hear is that people can do weekends, that you can work anti-social hours, so that's evenings, weekends, very, very early in the morning, perhaps night shifts. These are more difficult times to staff. So if you can say, I can do this, that's really helping your employer out. Instead of talking about your other commitments or why they are a massive barrier to you doing the job that's going to, mark you right down on this question, talk about how you have worked around school commitments. And if you can work the school holidays, it's a really great thing to mention, because it shows that you can work at a time where it's really difficult to get people working and maintain the standards of care. And so the absolute key to succeeding in this question, and why so many people do it badly, is that you have to focus on what you can do and not drone on about what you can't do. The more you mention can't, the lower you will score on this question. So absolutely always focus on what you can do and mention as many of the things that they want to hear, and that will boost your scoring on this question. The second one, standard care type question, is, what would you do if someone you were caring for collapsed? And if you give a very poor answer to this, it says that maybe you're someone that should not be employed because you've not got the basic competency. So there's some basic things to mention. So you want to talk first about getting help. You're not a qualified doctor. You're not going to be able to do everything that a fully equipped hospital can do. So you have to get help. So you start with nearby support, if there's anyone else nearby that can assist, and you contact the emergency services immediately. Then you go to the ABCD process. So start with airways, check the airways, then check breathing, circulation, and if it's a heart attack, you want to locate and use a defibrillator. Difficult word to say, defibrillator. And so if you mention these two things and you can talk in depth about the ABCD process, I recommend you look it up. Make sure you're very aware of CPR and discuss that, and you'll do quite well on this question. Moving on to question 3, what would you do if you suspected abuse and neglect? And there is a simple process to answer this question, and it just represents good practice. So, for example, you would talk about spotting people that are very unsanitary. So that suggests that they're really not being cared for appropriately. Any bruising, perhaps the person will disclose to you that they're being abused or neglected, or you may notice substantial changes in their behavior that causes you to suspect that something is not right. And so when you're answering this question, mention those things that tip you off as potential evidence of abuse or neglect, but then follow the arrow process. So start by stating your values. Say that you believe that everyone is entitled to dignity, and it's not acceptable for vulnerable people to suffer abuse or neglect, and that you can't do nothing when you see that. You have to say that you're going to make sure that you know exactly who to report to, who is the designated person. You're going to collate observations. So you're not going to go and question and do a big investigation, because that's, I suspect, not within your role. So you're going to make sure you've got all of the observations and all of the evidence, and that is submitted to the person that is responsible for that, and that you're going to continually pass on the information as it becomes available. So you're always following the procedures set down to the appropriate designated person to deal with investigating abuse and neglect. Moving on to question 4, this is a trick question, and if you answer it wrongly, you are very, very unlikely to get the job. So a relative asks you about test results from your patient. What would you tell them? So someone you're caring for has had test results and the family would like to know. And the absolute wrong thing to do is to tell them the test results. That is a violation of medical ethics. If you're aware of those test results, you cannot share them with anyone. The only person that is allowed to share that is the doctor, and they will share that with the patient or with someone who is allowed to receive that because of a whole long process that you were not involved in. So you and the patient have absolute confidentiality, and you do not disclose anything private to anyone um, regarding test results. It's just absolutely not acceptable. And if you say that you would tell them or you would go and investigate whether you can tell them, and you're open to this idea of just telling them about confidential results, that's going to be a big problem and could lose you the job. Moving on to the last question, where do you see yourself in 5 years? And there is a great way to answer this that scores very well, and there is a terrible way that will perhaps, seriously harm your chance to get the job. So the first thing you want to talk about is that your plan is credible. So you don't want to say anything ridiculous or sort of stupidly ambitious. That's going to count against you. You want to show that you've got a clear plan, that you've actually thought about how you're going to develop and where you're going. Then you can talk about this thing called CPD. That means continuous professional development. It's a posh way of saying training, that you're going to go out and get appropriate training. So some good things to talk about is perhaps leadership. Maybe in 5 years you want to earn, keyword being earn, some additional responsibilities and take on slightly more of a leadership role, progressively building up to that. So you can talk the general story about moving up. So what's one step above you and what do you need to do to earn that position? You could, if you're not looking for moving up, you could just talk about how you're going to become really outstanding as a care assistant and really, really talk about training and mentoring. So that how are you going to get better at what you're doing? So in 5 years' time, you should be way better at your job. That's a really great thing to mention. A terrible answer is something that's not credible and makes you look really silly. If you've got no idea and you just totally stumble, it really doesn't reflect well. And the worst thing you can do in this question is to say something that doesn't fit with your organization's goals. The absolute worst thing to say is not in the care sector or leaving or going to get a better job or something along those lines. That's a terrible way to answer it and will perhaps lose you the job. So hopefully this video has been very helpful to you. Best of luck in your care assistant interview and thank you very much for watching.